Hi everyone, so let us see this CET November 2024 revision series grand test quiz 1. Means I will give you another quiz 2 as well. So I am ready to give this test in the same manner like I am giving the test. I hope you have done well. Let us see. True for this device. This device is a pinhole device. When you take the vision with pinhole, the light goes from the center, and if the patient is having refractive error, the vision improves. And vision removes fully means 6 by 6 it can become if the refractive error is within 3 diopters, plus 3 minus 3 diopter. But vision is decreased if the patient is having central media opacity like central cataract, central corneal opacity, or any macular disorders like this. So person with age-related macular degeneration will improve. That is wrong. Stenopic slit is to differentiate colored halos, not pinhole. Now vision with 6 diopter myopia will improve with this, yes, but not fully. But yes, it will improve. But nuclear cataract is a central media opacity, vision will not improve. So true statement is this. Within 3 diopters, fully correct means the patient can see 6 by 6 line on Snellen's chart. 6 diopter patient will improve with any refractive error will improve with pinhole, but within 3 diopters it will fully correct. So अगर आपको चश्मा, if you don't want to wear spectacles, you can have pinhole in both eyes. If you have a refractive error in within plus 3 minus 3 diopter, that also is a type of refractive error correction. Pinhole लगा के घूमो, कोई बात नहीं. A patient of atrial fibrillation present to eye clinic with painless vision loss and examination perception of light and anter-segment was normal. Fundoscopy means retina examination was retina edema with red dot, that is cherry red spot. Cherry red spot is seen not in branch, so first branch is ruled out. In CR view there is a splash stomatoappearance, there is a blood thunder, hemorrhages, exudates, tortuous dilated vein in all of the retina. Central atrial artery occlusion is the answer, and because atrial fibrillation, the embolus is coming and blocking the central artery, causing cherry red spot. I hope you remember the differentials of cherry red spot. Two ocular conditions: CRAO, Berlin's edema, that is blunt trauma. So many biochemistry questions, biochemistry storage disorders like Tay-Sachs, Niemann-Pick, GM1, GM2, ganglioside, Sandhoff's. And Tay-Sachs and Niemann-Pick both have mental retardation, skeletal muscle weakness. Hepatosplenomegaly is seen in Niemann-Pick, not seen in Tay-Sachs. Now, which is false? C is anterior chamber from the posterior part of cornea till iris lens diaphragm. D is posterior chamber. A is canal of Hanover and B is canal of Petit. So B is not Cloquet. Cloquet canal is the canal containing the primary vitreous, that is hyaloid vessel joining the optic disc and the lens. If that persists, hyaloid vessel regresses by 8 months. If it persists, that is known as persistent hyperplastic primary vitreous. Which of the following devices is used to check intraocular pressure in case of corneal opacity? Is a factual question. Answer is tonopen based on McKay-Mark phenomena, that is indentation plus applanation tonometry. If I ask the question corneal infection, then pulsar non-contact tonometer is the answer. So tonopen for corneal opacity. Overall gold standard is Goldman applanation tonometer. Now this is primary gaze, the right eye and left eye shown. Left eye is covering the entire cornea. Which squint can be there? In out of the option, ptosis is there only in third nerve palsy. Third nerve palsy causes ptosis because LP is supplied by third nerve. So there might be down and out eye, there might be pupil dilatation, and there is ptosis. It has only ptosis can only be present in which cranial nerve palsy? That is third nerve palsy. Now this is something is put inside the cornea, inside the stroma of the cornea in patients of keratoconus. This is intracorneal ring segments, that is intacs or ICRS made up of PMMA, polymethyl methacrylate, in the stroma of the cornea to stabilize the cornea in keratoconus and can correct some refractive errors as well. So keratoconus is seen in a 20-year-old with this. 75-year-old senile cataract will not require this procedure. 25-year-old corneal exposure will require a patching or tarsorrhaphy. 52-year-old cases specific, that is maybe having Child-Causes or Wilson's disease. That is no vision is decreased. Here the patient is having myopic astigmatism with vertical stria, that is Walked striae. That is keratoconus, C option. Orbital cellulitis management is intravenous antibiotics. If it is not resolving, if there is an abscess, there is a drainage of abscess. If it is not resolving by that, you take out the eyeball with optic nerve with everything in the orbit. That is exenteration surgery. Now, Snellen's chart, the top letter is 6 by 60. From what distance? A patient with 6 by 60 means that from 6 meters he can see only the top letter. That's the definition of Snellen's chart. The answer is 6 meters. But if I ask 6 by 6 visual acuity can see the top letter from, then the answer is 60 meters. Here the definition is of Snellen's chart 6 by 60. Now I know many people must have made mistake in this. When you see a patient with 612 visual acuity, red eyes, circumcorneal congestion, hypopyon, mutton fat, KPs means anterior anterior granulomatous uveitis. Why granulomatous? Because mutton fat KPs are there. Why uveitis? Because circumcorneal redness, hypopyon are there. So in anterior uveitis there is small irregular pupil. I know many people might have mentioned festoon pupils, sir. We have read large irregular. That is seen after dilatation. The pupil in this is NEET exam question also. Small irregular pupil is seen in myopia, is seen in uveitis. If you dilate, then it becomes a large irregular, that is festoon pupil. And why dilate? Because cycloplegics are the adjunct treatment of choice, and all cycloplegics are mydriatics. The main treatment of anterior uveitis is topicosteroids. Answer is small irregular pupil because of posterior synechia between the iris and the lens. Now, diabetic patient with vision loss, hemorrhages, exudates, new vessels in the retina in a diabetic patient, straight away answer is proliferative stage of diabetic retinopathy. Even on iris or retina, and treatment is primary pan-retinal photocoagulation. Secondary is intravitreal anti-VEGF injections. So answer B is the answer. 2400 spots are there, sparing the macula, so side effect can be tunnel vision. Start with the inferior quadrant. A sequential picture is shown after topical phenylephrine can blanch, means reduce the redness in episcleritis and conjunctivitis. Superficial vessels are involved, yes. Nodular appearance can be there and seen in episcleritis, yes. Recurrence can be there, yes, but hypopyon is not seen in episcleritis or conjunctivitis. That's the answer. That is not associated. And third nerve palsy, all features except ptosis, down and out eye, classical diplopia is there in all gaze except down and out eye. Right, in right third nerve palsy, there is no diplopia on dextro depression. In third nerve palsy, no diplopia in levo depression when both eyes are in straight. Already the eye is in abducted position, so abduction limitation is not the answer. I hope you have done well. So let's see when the grand test 2 will be there. Best wishes.